I'm Jess, I'm a licensed psychologist, and we're talking about social media guidelines for psychologists. Today we're discussing Guideline 2.4, which states, psychologists consider the need to avoid contact with their current or past clients on social media, recognizing that it may blur boundaries of the professional relationship. Now, I already touched on this in my other video where I talked about Guideline 2.2, which is all about maintaining client confidentiality. But to reiterate, it is not appropriate for a psychologist to engage with their current or past clients on social media because not only does that blur boundaries, it can potentially break their confidentiality. To my knowledge, all ethical codes, regardless of mental health association or profession, have some codes surrounding dual relationships. Basically, a client and a therapist cannot engage in a relationship outside of that therapeutic relationship. Some examples of dual relationships would be a romantic relationship between a therapist and a client, a friendship between a therapist and client where they're going out on the weekends grabbing drinks together. If a therapist was having their client babysit their children, etc. And another example would be being friends with your clients on social media. Like Guideline 2.4 states, a psychologist and a client being friends on social media blurs the boundaries of that professional relationship. Being friends on social media can start scooting into that friendship zone rather than leaving the relationship purely professional. Additionally, there's risks that the client and the therapist may find out things about one another that they didn't want the other person to know. Additionally, there is always the risk for the client's confidentiality to be broken if the client and the psychologist are friends or engaging with one another on a social public platform. It's important that in the therapy room, the psychologist discusses these boundaries about social media with their clients so there is no misunderstanding.